Hello there, welcome to my channel. I'm Dr. Perkins, a board certified OBGYN, and today we're talking about how to get rid of bacterial vaginosis. By the end of this video, you'll get to know more about bacterial vaginosis, exactly what it is, how to get diagnosed, what your treatment options are so that you can get rid of it, as well as how to prevent getting bacterial vaginosis. So bacterial vaginosis is an infection of the vagina wherein a specific bacteria, usually called Gardnerella vaginalis, may overgrow, causing an infection. This is an infection that you may feel symptoms or you may not. And with that, the most common symptom for those who do experience symptoms would be getting like a vaginal odor that is very fish-like, especially with sexual activity or tampon use or any kind of activity down there. Now, this infection is very, 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 very common. Most people have the infection or have had it at some point in their lives, but didn't know. Do know that these infections can actually clear on their own. It's pretty exciting because when you're young, you're healthy, your body's pretty strong, you're feeding your body with everything that it needs to maintain its cell and the function of your organs. Really, your body will clear an infection on its own down there with time. And so it's a wonderful thing. But for those who do know, who've been tested, treatment is available. And we're going to talk about that today. But before we dive in, let's talk about how bacterial vaginosis is diagnosed. First off, you go to your doctor's office. It could also be a provider. So whenever I mention a doctor, it's not necessarily just a physician. It could also be a nurse practitioner or a certified nurse midwife or a family physician. It could be your OBGYN. It could be anyone. Whoever your provider is, they will establish several different things. Your history, get information about your symptoms, and they'll also perform an exam of the vaginal area. With that, a sample will be taken, which means that we're literally dipping what looks like a Q-tip in the vaginal space, saturating it with the discharge that's present. We send that off to the lab. The lab will do a breakdown, give us an evaluation and a report, and that report will say what type of bacteria is being overgrown, how many. You can have several different ones that could be overgrown at the same time, and what that infection is. We may also check by doing a test on a slide that you'll use with like a microscope to take a look. It's a much faster test because these can be done in the office, in the clinic. This can be done in the hospital, like right on site. And so with that, we're looking for specific things called clue cells. And with these, we're able to determine whether or not you have an infection, and we can determine that right away. Now that's for the testing portion of things. What I will tell you is that some of this testing also looks at the pH level of the vagina. The pH is very important because the likelihood of getting a bacterial vaginosis infection is increased when the vaginal pH changes. This is often what people would refer to as having an imbalance in their pH, or you may say my pH may be thrown off. These are things that leads to these types of infections. And so knowing the vaginal pH level is super important in helping us diagnose what the infection that is causing your problem really entails. And so normal vaginas like to be in an acidic range of 3.8 to 4.5 on the pH scale. Whenever we check the sample of your vaginal space, we will get an idea of where your vaginal pH lies. The pH in bacterial vaginosis will often be elevated, so it could be like 4.5 to 5 or even 5.5. And for a vagina, that is actually a very big drop in the acidic level because vaginas love to be way more acidic. They love to have numbers lower than 4.5, lower than even 4.0, because that's a state that makes it so much better. Now, once that pH rises, it gives us an idea of whether or not clue cells will be present, whether or not you have this infection, and whether or not you may in the future develop this infection. Both of these types of testing will give us answers. Now, once we have that diagnosis of having bacterial vaginosis, then we have options for treatment. There are 2 different antibiotics that we use right here in the United States for treatment of bacterial vaginosis. The most common is called metronidazole or Flagyl. It's a wonderful medicine. It works great at clearing the infection, getting your vaginal pH back to normal, getting the bacteria that is overgrown to be reduced to its normal levels very quickly. And it's really just a very effective treatment. Sometimes you may have a resistance to that medicine, so that when you use it, the infection essentially doesn't clear. And there's a second option of using clindamycin for treatment as well. Metronidazole can be given in 2 different forms. You can take it by mouth in a pill version, or you can have it as a gel that goes in the vaginal space and works just as well. The difference between the 2 would be in the days of treatment that you get. In general, when you're getting the pill, you'll take the pill for about 7 days. And in general, when you use the gel, you use that in the vagina for 5 nights. Regardless of how you take metronidazole, it is very important to know you do not have alcohol while you are getting this treatment. Okay? You don't want to. Promise you don't want to. You can get really, really, really sick if you do that. And that's regardless of whether or not you're taking it by vagina or by mouth. Now, that's my little disclosure there. But outside of that, metronidazole works wonderfully to clear this infection. One thing that is very common when you're getting treatment with these antibiotics is this antibiotic may increase the likelihood or cause you to have a yeast infection. It's a part of the reason why we often say if you don't have symptoms for bacterial vaginosis, then we might not want to treat it, because getting this one antibiotic leads you to having another infection, which means that now you'll need another prescription potentially or medicine to clear the second infection. And so if you're not having symptoms, don't be alarmed if your provider says, hey, I might not necessarily recommend that you treat this. And the second reason is that oftentimes bacterial vaginosis can clear up on its own. Yes, when you're young, you're healthy, your body is able to clear this infection without any intervention whatsoever. We're often conditioned to think that if we see a problem, we should fix it. It's almost automatic. There's an infection. Why would we know that we have an infection and do nothing about it, right? That would be kind of weird. And so because of that, we're more inclined to wanting a treatment of some form once we know that an infection is present. And you're not wrong for wanting that, but just know that the option also is there that if you're not having symptoms, that you really can just give your body several weeks to clear this. And you can even check again and say, hey, is the infection gone? Is it still present? Are you having any issues? And then treat accordingly. The choice is yours. In this video right here, I dive into other home options for treating bacterial vaginosis without needing a prescription. So if you'd like to check it out, go ahead. Here's the information right here for you. But I do want to mention here that oftentimes patients will ask me, well, which option is best for me as far as taking treatment by mouth or having it in the vagina? Both options work marvelously with clearing the infection that is BV. Now, if you are pregnant, it's recommended to take the treatment by mouth. If you're not pregnant, you can choose either direction. Some people are very comfortable placing things in the vagina, others are not. Some people are very comfortable taking pills by mouth, others are not. So really just find what works best for you. As long as you're getting treated, the infection can be cured and everything can be cleared. So how can you prevent getting a bacterial vaginosis infection? There are some people who come to me in my office and they're just like, listen, I've had 6 bacterial vaginosis infections this year, or I just keep having this every single month after my cycles, after sexual intercourse, after just regular activity. Like, how can I stop getting this infection? And I almost always feel what you're going through, because That used to be me. Many years ago, I would get bacterial vaginosis on a regular basis, and I was just like, well, what am I doing wrong? And it really called for investigating deeply in my lifestyle as far as trying to find the culprit, the trigger, the thing that is causing these infections to recur in your system. It doesn't mean your system is broken. It just means that we need to make small adjustments. And so here are some of the things that I would recommend that you look into or consider changing. First off, we want to reduce using a lot of fragrances down there. The way that the market is set up right now, we're so encouraged to want to get things that smell really good, very nice and flowery. We can smell like anything. But all these fragrances really can disrupt the pH down there. And once we have a disruption to that area, we increase the likelihood of getting an infection. So we're so inclined to wanting to put so many sweet smelling things down there that it really just throws our pH off and increases the likelihood of us getting an infection. And so what things are we talking about? We're talking about fragrances, things that have very strong smells. We're talking about moisturizers, body washes, soaps. We're talking about vaginal perfumes. We're talking about douching, all things that we don't recommend doing. The best way to actually care for your vagina is to use products that are unscented and those that are for like sensitive skin. I also recommend that you do not use hard soaps. What is a hard soap? A bar, like a normal bar that you would use in lather and wash your body. And the reason is there are lots of chemicals that are used in a bar soap that can cause infections and irritation of the vulva. And the reason is for you to make soap into a bar that slowly disintegrates over time, a lot of chemicals are used to make that active ingredient soap actually work. And so with that, those chemicals can affect down there. The alternative is if you use a body wash that is a liquid wash, many of those chemicals are not present in a liquid wash. So consider using that instead and opt in for one that does not have a lot of fragrances as well. Outside of those things, also try to avoid things that you found triggers an infection being formed in your system. Sometimes that could be your period, and if you can avoid a period, whether that be being on a birth control or something like that, or being prepared to put something in place during your cycle or shortly after your cycle, such as boric acid, to help to replenish the acidity and the pH level of the vagina. You can try to preemptively prevent an infection from forming if you know that you get these infections following a cycle. Very similarly, if you get these infections following sexual intercourse, you may also want to say, hey, maybe I should integrate some boric acid treatments right after sexual activity so that I can just help my vaginal flora be its best. So I hope you learned something today. I have a free gift for you that I'm so excited to share with you. It's a free copy of my ebook, Hormones Don't Lie, because they don't. We just have to listen to them. And so I help to guide you in a way that helps you to understand how your body works and responds to the hormones within it. And so to get a free copy of my ebook, go ahead and click the link below, and I'll be more than happy to share that with you. Thank you so much for being here with me today. It's been lovely as always. I'm Dr. Perkins, a board-certified OBGYN who's too passionate probably when it comes to vaginal health and female reproductive health. But listen, I thank you for being here. Thank you for listening, and I hope to see you next time.